Hello everyone. Welcome to this audio podcast overview of a research poster presentation, which had been presented, which was a research poster presentation, a collaborative research poster presentation presented at at the Excellence in Paediatrics in 2012. The research poster presentation was collaborative. It was a collaborative between a social media platform, the Renal Patient Support Group, and NHS Kidney Care, which unfortunately, as part of the NHS National Health Service, no longer specifically exists. And also where there was a collaboration between colleagues in parts of in different academic institutions at the time and so this research poster presentation looking at how using social media can help raise chronic kidney disease or CKD awareness. And at the time of the research poster presentation, this was a sort of a 3 years sort of 3 years of where the RPSG had been founded. So the research poster presentation, the research poster presentation sort of looks at an overview of the RPSG, the Renal Patient Support Group, at 3 years at the time. And so in this research poster presentation, there will be a look at the aims, some background, looking at using social media and what's on the RPSG, at least in the time when the RPSG was conceptualized, or near when conceptualized, and a look at sort of the some of the RPSG activities. Some of the RPSG activities. I look at some of the RPSG research works and projects between in around that year between 2011 and 2012, and then I look at sort of what makes the RPSG a success. What makes the RPSG a success, and I look at some of the ongoing works, and then I look at some conclusions. So my name is Shahid Nazir Mohammed, and so on behalf of the RPSG, on behalf of the Renal Patient Support Group, the RPSG, I look at this works on how using social media can help raise chronic kidney disease awareness, and the RPSG, the Renal Patient Support Group, at 3 years. As part of the aims of this works, the objective of the works was to highlight how using social media has helped provide insight and awareness surrounding chronic kidney disease through the RPSG. Secondly, to provide an insight into how the RPSG has successfully allowed primarily or primitively a Facebook platform, social media platform for communication and interaction for healthcare service users with chronic kidney disease, CKD, and general Facebook, and also also those who may use, for example, another social media platform, being Blogspot, which is primitively or primarily a blog, a sort of a blog or journal, a journal like social media platform. Thirdly, to highlight how peer support programs that are currently implemented or have been implemented in the National Health Service or in National Health Service or NHS Trust can improve certain aspects of programs utilizing the social utilizing Facebook as a social media platform. And then fourthly, to highlight how the RPSG has successfully implemented research using social media platforms. So, as part of the intro to this works, the RPSG was initially introduced or founded even by three individuals, two patients and one long time carer in 2009. The initial intention of the RPSG sort of co-developers was to help support fellow patients or healthcare service users following routine clinical outpatient appointments at a particular NHS trust in the southwest in the United Kingdom. The RPSG co-developers had known or knew that it would be a challenge to provide support to fellow patients face to face in the clinical outpatient setting, sort of to provide patients face to face support in the clinical outpatient setting, owing to time limitations. So having the internet or the World Wide Web as a resource, the RPSG co-developers decided then to investigate and explore an online platform, and thus the Facebook social media platform was sort of born in around October 2009. And so, since the RPSG allowed the code developers to interact with patients from the local NHS National Health Service or NHS Trust, using Facebook, using the Facebook, though primitive social media platform in its own way, the code developers had also knew that the social media platform attracted healthcare service users healthcare service users and healthcare service users and carers of patients healthcare service users and carers going through CKD, going through chronic kidney disease or various forms of CKD, to gain more insight from across the globe, where everyone is able to interact and ask questions and post messages and retrieving instant responses. The RPSG at the time of this works in around 2000 and between 2011 and 2012, the RPSG RPSG social media platform had over a nine, just under or near a thousand, near 1,000 healthcare service users at various stages of chronic kidney disease, and had 10 members to the admin and research team from the United Kingdom, from the United Kingdom, Europe, and including sort of and including Australia and the United States, who had given time and dedication in seeing that the social media platform is facilitated. The RPSG offers primarily offers online peer support globally with members sharing with healthcare service users and carers sharing and caring. The RPSG, as per mentioned, the RPSG has a research team, and the research team is also active, or has been active on various nephrology relating works. So now looking at using social media and what's on the RPSG, and bear in mind that at the time of this research poster presentation, it was in around 2012. The sort of basis, or the basis of what's on the RPSG has prospectively transitioned into various aspects of and in supporting healthcare service users and carers. However, at the time, as part of this research poster presentation, there was a basis in around what's using social media and what's on the RPSG. So the RPSG social media platform and social media page, and the blogspot, and at the time of this works, this collaborative works, there was a basis where the RPSG had sort of projected it, to utilize the social media platform in aligned to Facebook, and then additionally a blog page, which was initialized for non-Facebook users, or non-Facebook users. So the RPSG the RPSG social media page primarily being Facebook, and the RPSG blogspot pages included number one, firstly, patients sharing real life experiences, healthcare service users or patients sharing real life experiences and supporting each other. Secondly, helpful links for all, and all the latest links and websites and group pages and guidelines and standards related to kidney care. Also, to iterate here, listeners and viewers, is that the RPSG at the time and still had various links, and have various links to different aspects of different standards, different frameworks, different aspects of kidney care that for example might be pertinent and specific to a country, for example, to a country, but to one country, for example, but may not be pertinent or important to another country, thus allowing and prompting a sense of a sense of inclusion where a sense of inclusion and diversity where, for example, it may not be the case, may not be in the case in sort of works in line to aspects of kidney care or nephrology care in sort of in some regard historically, and at the same time, thirdly, there were video links that may have been of intrigue to different healthcare service users and carers. Fourthly, sort of academic and research papers that may be of intrigue to healthcare service users and carers. There was a dedicated sort of research folder which sort of housed the different sort of works, different evidence-based works pertaining to aspects of nephrology and kidney care. And sixthly, there was a dedicated sort of a folder, if you like, on the RPSG social media platform pertaining to voluntary patient activity opportunities. Since as many may know or may not be aware, either or, that healthcare service users who go through this sort of condition tend to have a lack of opportunities in context of employment, and so there were pages on the RPSG pertaining to voluntary opportunities where healthcare service users and carers could look to identify thus by being involved in voluntary based works, thus increasing the probability and thus increasing the probability of sort of increasing the opportunities around sort of employment, and for those who are for example young CKD sufferers or transitioning into adult nephrology healthcare services, for example, where they have opportunities to update their background, thus providing by being involved in sort of voluntary opportunities, and again where there may be a lack of opportunities for young patients. Number 7, there was a list of kidney patient associations or KPAs and relating or regarding groups and pages. Eighth, there were photographs or images of various social like events. And ninth, there was on the RPSG social media platform, there were event posters and flyers in a dedicated folder. So now, looking at some of the earlier RPSG social activities and some of the media attention, since the RPSG had been involved in sort of works sort of early on. The RPSG the RPSG team had sort of the fortunate sort of circumstances in some regard that there was a sort of a call for aspects of work to be shared through media, and thus there was there was early on a sort of a media attention around the Renal Patient Support Group, alongside with additional works. So firstly, there was the World Kidney Day and a renal health awareness World Kidney Day and renal health awareness, sort of a media attention, which was which was evidenced which was evidence and sort of part of media attention in a in the Bristol sorry in the newspaper, the Bristol Evening Post. In the Bristol Evening Post, to cover World Kidney Day and sort of renal health awareness in March 2011. Secondly, there was a World Kidney Day and solid organ transplant sort of awareness on a BBC on a BBC on a BBC BBC radio show in the southwest region, again in Bristol, in around the 12th of March 2011, and the radio show, the BBC radio show, was with a sort of an invited sort of interview with a physician, with a primary care physician, and where this primary care physician also had a radio show. And thirdly, there was a World Kidney Day in 2012, and part of World Kidney Day 2012, there was a sort of a collaborative, between one particular kidney patient association, or KPA, in the southwest, and the RPSG, the Renal Patient Support Group, where there was a collaborative between the organisations in aligned to a World Kidney Day 2012 bowling and coffee mornings which was hosted to raise CKD awareness. Now going on to, or moving into some of the some of the research works, the early research works in around between 2011, specifically around 2011 and 2012. So firstly, for World Kidney Day 2012, the RPSG hosted a series of e-sessions on how using social media can raise CKD awareness, in collaboration with NHS Kidney Care, NHS Kidney Care. So just to additionally inform here, is that whereas this poster presentation was works that was presented at Excellence in Paediatrics 2012, sort of in the same sort of time duration, there was a sort of a basis in around the same duration, where the RPSG, alongside with NHS Kidney Care at the time, had hosted collaboratively a series of e-sessions, which invited both healthcare professionals, carers, as well as healthcare service users, to informed on different aspects of kidney care, but where these different aspects of kidney care were e-sessions that were themed, and they were the e-sessions at the time were actually carried through through a WebEx a sort of WebEx WebEx platform, as well as and additionally sort of Skype at the time. Secondly, the RPSG also hosted, helped coordinate a sort of small project with an organization an organization known as Renal Patient View, or Patient View, which is known as Patient View now, which is known as Patient View in more recent times, is known as Patient View in more recent times. But additionally, Patient View is primarily an electronic patient record, record facility where healthcare service users and carers can look to access different aspects of healthcare, sort of at their own time, in their own time, or rather than, for example, waiting for, where traditionally or historically, where, for example, if healthcare service users have for example, blood tests, for example, have blood tests, and then wait until the lab tests, laboratory or blood tests are done, are completed, and then irrespective of whether for example, irrespective of whether a laboratory test is shows an abnormality, shows abnormality, or may show, or may be where the laboratory investigation may be within a normal range, in a parameter within a normal range, then irrespective, historically it would be where healthcare professionals would tend to call healthcare service users, if for example, there's a need to repeat blood tests, for example. Thirdly, the RPSG had also conducted various surveys to collect data which had been used to feedback to enhance care, and for example, an RPSG survey on what do you find most helpful about the RPSG, the data established that at least around 36% of healthcare service users and carers, for example, found that it was interesting or intriguing to know that they're not alone going through the condition, going through kidney disease or various forms of kidney disease. And this survey also highlighted that utilizing the RPSG, around 27% at the time found that communicating with healthcare service users and interacting had been advantageous. And in a survey, an RPSG survey, in regard to what's the worst thing about being a patient, data established that at least around just over 30% of healthcare service users and carers found that they are afraid, anxious, or had anxieties, and sort of psychological concerns. And then a survey a survey was also implemented to understand what processes and strategies people adapt to cope with chronic kidney disease, or CKD. And this survey highlighted that learning and laughing were the main ways that people with a CKD cope, and cope with illness, and in around where the response was at the time around 22%. The RPSG at the time was a young group, and it encouraged, it was encouraging to identify that healthcare service users and carers, which consisted at the time and still of healthcare service users. Service users and carers of various ages, ethnicities, backgrounds, from and backgrounds from all all around the world, and then a and then at the same time, the RPSG has been a sort of a positive way for people to cope, since the RPSG has encouraged the platform, a social media platform for interaction, communication, and retrieving detailed insight on kidney care for a great number of people. And then as part of the sort of final part of the sort of research and sort of projects aspects of the RPSG, another RPSG survey on can social media, not just Facebook, help raise CKD awareness or kidney disease awareness, established that around 89% of the healthcare service users and carers have found have found that social media generally can help raise CKD, chronic kidney disease awareness, and in following the RPSG blogspot, the RPSG blogspot was developed, was initiated. It was initiated sort of more formally by a research lead and facilitator, and the RPS at the time the RPSG also used Skype to host sort of additional e-sessions on different topics relating to CKD accordingly. Now looking at as part of this research poster presentation, looking at what makes the RPSG a success. So Facebook, though sort of primitive in its own way, allows a good general platform for people to interact. 10 members to the admin and sort of research team, who all bring a specific expertise, allowing good administration, allowing good administration and moderating. Thirdly, the RPSG initially in its early times, it was an open group. The RPSG sort of later, after where the RPSG administration team at the time had developed a sort of poll, if you like, to ask RPSG users to respond to whether they would like the RPSG to continue as an open group or have it as a closed group. And it was later identified that the majority wanted it as preferred the RPSG to be a closed group. So the RPSG, in following the poll, had been developed. It had been changed into a closed group, and for the purposes of this research presentation outline, there won't be a sort of a basis in around the discussion around the difference between an open group and a closed group in context of social media. And then additionally, the RPSG and Facebook generally had appealed to all audiences, and the RPSG raises CKD issues and awareness at all stages. And severity of the condition. The RPSG also organizes and has been involved in research and collaborations to collect mixed methodology based works. The RPSG again has hosted Skype e-sessions. The RPSG organizes social activities by developing events and advertising on Facebook where Facebook at the time had sort of an events pages. And then the RPSG blogspot had been formed for non-Facebook users, and also had very up to date information. And then the RPSG users again share real life experiences in real time from across the globe, and this allows healthcare service users and carers to learn about CKD or chronic kidney disease from various parts of the world. The RPSG encourages patients to interact with local kidney patient associations, and to find out how they can be proactive in the care for fellow peers. And then finally, the RPSG does projects, or has been involved in project works to support to support both primary and secondary healthcare sectors. Now looking at the RPSG and some of the ongoing work. So in following, the RPSG had put forward a sort of a fun day, a picnic or fun day, had put forward a basis in around a sponsored walk, had put forward had put forward its basis in regard to the a solid organ transplant campaign that took place, that was set to take place between 2013 and 2013 2014, and where the launch of the initial launch of the campaign works was in regard to the National Kidney Federation Black and Minority Ethnic Groups Manifesto, which was launched by the National Kidney Federation in 2012. And then one of the lead researchers for the RPSG had fed into a health record access initiative, where the initiative was a sort of a collaborative between the RPSG and the patient view, or PV. And then there was a basis in where the RPSG had looked to implement more qualitative research, collecting data on sort of in around some of the more advanced aspects of and in surrounding chronic kidney disease. And so now looking at the conclusions. So as a non-funded voluntary social media platform, at the 3 years, and again, listeners and viewers, this was works that was done, that was collaborative, presented at the Excellence in Paediatrics, or EiP, in 2012. As a non-funded voluntary social media platform, at 3 years post co-development, the RPSG had allowed the admin and research team to raise CKD awareness and prevention using social media successfully, and this had been achieved through primarily and sort of primitively through Facebook, Blogspot, and Skype e-sessions, where topics are pulled together and hosted by a member of the RPSG, by a member of the RPSG. Secondly, as part of the conclusion, the RPSG had successfully allowed the platform for interaction, prompted a platform for interaction and communication, which also allowed gaining insight from hard to reach populations, and the distributing information on chronic kidney disease to general Facebook users. Thirdly, where peer support programs within the National Health Service Trust, NHS, within the National Health Service, or NHS Trust, for CKD and end-stage renal disease recipients or healthcare service users have been piloted and fully implemented. The NHS at the time of this works, where the RPSG had informed as part of the conclusions that the RPSG should also consider implementing sort of a social media platform to allow shared caring and learning. And then finally, research has been an important essence of the RPSG. The RPSG is the only social media platform that collected data and published information for its users, and the RPSG had encouraged researchers, investigators to get involved for potential collaborations. That is the end of this audio podcast overview of this research poster presentation, this collaborative research poster presentation looking at how using social media can help raise chronic kidney disease (CKD) awareness, and looking at the Renal Patient Support Group, the RPSG, at 3 years. At 3 years, and where this research poster presentation was presented at the Excellence in Paediatrics in 2012.